In this session of the Pediatric Emergency Medicine Fellows Research Design course, we will review the course examination. We're at the finish line of the course. On to our questions. As a reminder, these are the same questions that we answered at the end of each session. The first topic is asking an answerable research question. What is the appropriate outcome for a search question for a diagnostic test accuracy study when formatting a question using the PICO mnemonic? Patient and population, intervention, control, and outcome. Disease prevalence, disease severity, the criterion gold or reference standard, test characteristics, or disease incidence. The answer is D, test characteristics, sensitivity, specificity, predictive values, and likelihood ratios. The appropriate PICO criteria for a diagnostic test study is P is a patient with a suspected disease, I is the diagnostic test, C is the criterion standard for disease, and O is the operating characteristics of the diagnostic test. What is the appropriate intervention for a research question for a prognosis study when formatting a question using the PICO mnemonic? Patient, intervention, control, and outcome. Disease prevalence, prognostic factor, time, Kaplan-Meier survival curve, or disease incidence? The answer is B, prognostic factor. In a prognosis study, a patient with a disease is followed over time to determine if they develop a complication of disease, for example, mortality. These are often called time-to-event analyses. The appropriate PICO criteria for a prognosis study is P is the patient with disease, I is the prognostic factor, C is no prognostic factor, and O is the disease outcome over time. A study is designed to determine the effectiveness of oral hydrocodone for ear pain related to acute otitis media. Patients are randomized to receive hydrocodone or a placebo. Which of the finer criteria does this violate? Feasible, interesting, novel, ethical, or relevant? The answer is D, ethical. Placebo-controlled studies of pain relief are unethical. The standard of care in patients with acute otitis media is to provide analgesics in addition to antibiotics. A more appropriate study design would include a comparison of hydrocodone to acetaminophen or ibuprofen. A first-year pediatric emergency medicine fellow wishes to study the impact of the protein conjugate pneumococcal vaccine, Prevnar, on the epidemiology of occult bacteremia in children 3 to 36 months of age. Which of the finer criteria does this violate? Feasible, interesting, novel, ethical, or relevant? The answer is A, feasible. While this is certainly an interesting question, it would be extremely difficult from a feasibility standpoint. To determine the bacteremia rate with a reasonably small confidence interval, many patients would be required. In addition, current recommendations suggest that it is unnecessary to evaluate patients who have received their primary series of Prevnar for occult bacteremia, further limiting the number of potential patients to be enrolled. The next set of questions are on searching the medical literature. Which of the following is not a medical literature database? Medline, PubMed, Embase, or the Cochrane database of systematic reviews? The answer is B, PubMed. PubMed is a search engine that is used to search the Medline database. You have developed a research question. Which database should you search? Medline, Embase, or Medline and Embase? The answer is C, Medline and Embase. Medline is the U.S. citation database, and Embase is the European equivalent. The Medline and Embase databases use different classification structures. Mesh for Medline, Mtree for Embase. This results in different search results. Searching both for a research question would give the most comprehensive results. Which search engine gives you access to multiple databases? PubMed or Ovid? The answer is B, Ovid. PubMed searches the Medline database. Ovid also searches the Medline database, but has access to the other databases such as Embase and the Cochrane database of systematic reviews. PubMed searches the Medline database. Ovid also searches the Medline database, but has access to the other databases such as Embase and the Cochrane database of systematic reviews. The next questions are on the design of observational studies. Which observational study design is not subject to recall bias? A case control study, a randomized clinical trial, retrospective cohort study, or prospective cohort study? The answer is D, prospective cohort study. Recall bias can occur with retrospective studies. The outcome is measured in the present and the exposure is assessed based on the past. Memory may be faulty or biased by the presence of the outcome. Both retrospective cohort and case control studies are retrospective. The only prospective observational study is a prospective cohort. A randomized clinical trial is an interventional study and not an observational study, and is also prospective. Which observational study design is subject to detection bias? Case control study, randomized control trial, retrospective cohort study, or prospective cohort study? The answer is D, prospective cohort study. Detection bias occurs when the exposed group is followed forward in time and may undergo more rigorous evaluation for the outcome. For example, patients with an exposure to a known carcinogen may be followed more closely and undergo screening tests for cancer more frequently. Therefore, the outcome can be identified more frequently in the exposed group. This may artificially increase the measure of association between the exposure and the outcome. The only observational study design that follows patients forward in time and is therefore susceptible to detection bias is a prospective cohort study. Which observational study design cannot be used to determine a disease prevalence or incidence? A case control study, randomized controlled trial, retrospective cohort study, or prospective cohort study? The answer is C, case control study. The investigators determine the ratio of cases to controls in a case control study. For example, the investigator may choose 50 cases and 50 matched controls. The prevalence of cases is set at 50% by the investigator. A prevalence or incidence cannot be calculated from a case control study. A prevalence or incidence can be calculated from a retrospective or prospective cohort study. A randomized control trial is not an observational study. A study measures an illness as 15 deaths per person per 2-year period. This measure is called prevalence or incidence. The answer is B, incidence. Incidence is defined as the rate of an outcome over a specified time interval. For example, many cancer studies report a 5-year survival rate. Prevalence is defined as the rate of an outcome at a specific point in time. What would not increase the likelihood that a statistically significant association is also a causal relationship? Biologic plausibility, a temporal relationship with exposure preceding an outcome, a large magnitude of association, a large sample size, reproducibility of the study's results, or a dose-response relationship. The answer is D, a large sample size. A larger sample size can increase precision by narrowing the confidence interval, but does not increase the likelihood that an association represents a causal relationship. Observational studies provide a measure of association, but a statistical association does not necessarily imply a causal relationship. For example, carrying matches or a lighter is associated with lung cancer, but carrying matches and lighters are not the cause of lung cancer. There are a number of factors that can increase the likelihood that an association is also a causal relationship. These are defined by the Bradfield-Hill criteria. Biologic plausibility means that the science makes sense. The strength or magnitude of association can also increase the likelihood of causality. For example, a relative risk of 10 is more likely to be causal than a relative risk of 2. A dose-response relationship is seen when a higher magnitude of effect is seen with a higher degree of exposure, such as a higher dose of medication. A temporal sequence is present when the exposure had to precede the outcome. Repeat studies that demonstrate the same direction and magnitude of the association can help to establish causality. The next questions are on the design of interventional studies. The data from an asthma study is presented in the 2x2 table below. The aim of the study was to determine if nebulized epinephrine decreased hospital admission when compared to placebo in patients with a moderate asthma exacerbation treated in the emergency department. What is the absolute risk difference in this study? 20%, minus 70%, 10%, 70%, or minus 20%? The answer is 70%. First, calculate the absolute risk of admission in the epinephrine group. This is 10 out of 100, or 10%. Next, calculate the absolute risk of admission in the placebo group. This is 80 out of 100, or 80%. By convention, the absolute risk difference is the absolute risk in the control group minus the absolute risk in the intervention group. In this example, the absolute risk difference is the absolute risk in the placebo group minus the absolute risk in the epinephrine group. This is 80% minus 10%, or 70%. There are 70% fewer admissions in the epinephrine group compared to the placebo group. Which box letter represents allocation in the diagram of a randomized clinical trial? A, B, C, or D? The answer is box B. Allocation is the process of getting patients into the groups they were randomized to. If allocation is not concealed, then patients may not get into the study group they were randomized to, and the benefits of randomization may be lost. Box A indicates randomization. Box C and D represent the two study groups. Which box in the consort diagram below indicates an intention to treat analysis? Box A or box B? The answer is box A. An intention to treat analysis would include all the patients randomized to each group, whether they receive the intervention or not. In contrast, a per-protocol analysis would include only those patients that receive the intended study intervention. Which study methodology is not a way to reduce bias, that is, systematic error, in a randomized clinical trial? Randomization, allocation concealment, propensity matching, intention to treat analysis, or blinding? The answer is C, propensity matching. Propensity matching is used in observational studies. It serves the same purpose as randomization in clinical trials, to equally distribute known confounders to each of the treatment groups. Randomization, allocation concealment, intention to treat analysis, and blinding are all methods to reduce bias or systematic error in clinical trials. While searching the Cochrane Clinical Trials Registry for an upcoming talk on the management of the critically ill patient in status asthmaticus, you find a study proposal to compare a new, non-FDA approved asthma medication to standard asthma therapy. The study investigators need to enroll 7,000 patients in a multi-center trial. What FDA phase would most likely match the proposal? Phase 0, Phase 1, Phase 2, Phase 3, or Phase 4? The answer is Phase 3. The research trial is best described as a Phase 3 clinical trial. The study is enrolling several thousand patients with a known medical condition, asthma, and is evaluating a new therapy versus standard therapy to achieve a clinical outcome. The fact that it is not yet FDA approved indicates that it is not a Phase 4 study. The next set of questions is about the design of diagnosis studies. What aspect of a diagnostic test may be studied? Precision or reproducibility, accuracy or test characteristics, the impact of test utilization on outcomes, prognosis of disease based on a test result, or all of the above? The answer is E, all of the above. Many aspects of a diagnostic test can be studied. The most common diagnostic test study is diagnostic test accuracy. What study designs can be used to study diagnosis questions? Cross-sectional, case control, randomized controlled trial, prospective cohort, or all of the above? The answer is E, all of the above. There are many diagnosis questions that may be answered by a variety of study designs. Cross-sectional studies are used to assess diagnostic test accuracy. Case control studies can be used to assess diagnostic test accuracy when a disease outcome is rare. Randomized controlled trials can be used to test the impact of diagnostic test on outcomes. Prospective cohort studies can be used to determine if a diagnostic test has prognostic significance. Blinding of the test assessor to the outcome and of the outcome assessor to the test result is always required in the study of diagnostic test accuracy. True or false? Blinding of the test result assessor to the outcome and of the outcome assessor to the test result is used in most diagnostic studies to reduce the risk of ascertainment bias. This is particularly true when the outcome is subjective. For example, knowledge of physical exam findings may bias lung ultrasound interpretation. When an outcome is objective, blinding may not be required. For example, it would be difficult to bias an outcome of bacteremia, a positive blood culture, by awareness of the white blood cell count. A clinical decision rule was derived at a single institution, validated in a multi-center trial, and shown in additional studies to reduce resource utilization to the degree identified by the original study. What stage of development is the clinical decision rule? Stage 1, Stage 2, Stage 3, Stage 4, or Stage 5? The answer is A. It is a Stage 1 clinical decision rule. It has gone through derivation, a broad validation, and an impact analysis confirming the initial results. Stage 2 is a broad validation, Stage 3 is a narrow validation, Stage 4 is derivation only, and Stage 5 does not exist. A clinical decision rule for appendicitis was derived at a single institution and validated in the same split data sample. How can this rule be applied? needs further evaluation before it can be applied, can be used with caution if your patients are like the study population, can be used with confidence in various settings, or can be used with confidence in various settings that it can change a physician's behavior and improve patient outcomes. The answer is A. The rule needs further validation before it can be applied clinically. The applicability of a clinical decision rule is dependent on its stage of development. The clinical decision rule described in the question is a Stage 4 clinical decision rule. It has been derived only. Internal validation in the derivation sample does not constitute either broad or narrow validation. Stage 4 rules should be used with caution until they are validated. Response B corresponds to a Stage 3 rule with narrow validation. Response C corresponds to a Stage 3 rule with broad validation. And response D corresponds to a Stage 1 rule with an impact analysis. The next set of questions is on selecting subjects and variables. You are designing a randomized clinical trial of a new medication for migraine headaches and are determining inclusion and exclusion criteria. Which of the patient characteristics below should not be part of the exclusion criteria? Allergy to a medication in the same class as the study medication, inability to speak English, likely to be lost to follow-up, or pretreatment with an analgesic. The answer is B, inability to speak English. Patients should not be excluded from enrollment based on a non-English primary language. Enrollment should be equitable. The principle of justice in clinical research entails that the benefits and burdens of research be distributed equally. Patients who should be excluded are those at increased risk from participating in the study, such as those with an allergy to the study medication, those with potential confounding characteristics, such as those with significant comorbid conditions and pretreatment that could confound the study intervention, and those who are unlikely to comply with study intervention and unlikely to be available for follow-up. Which sampling technique is an example of a convenience sampling? A sample of consecutive patients presenting to the ED, a random sample of a proportion of presenting patients, a random stratified sample of two subgroups of interest, a random community sample based on zip code, or enrollment of every third patient. The answer is A, a sample of consecutive patients presenting to the ED. Convenience sampling is the most used sampling technique. However, it may be susceptible to enrollment bias because it is not based on randomization. For example, a convenience sample of patients enrolled based on investigator availability from 9 a.m. to 5 p.m. Monday to Friday may be biased if patients presenting on evenings, nights, and weekends have different characteristics. Answers B to E are all examples of probabilistic sampling. Which of the following techniques should not improve the precision of a measurement? Standardizing the measurement method, training and certifying measurers, automating the measurement, making unobtrusive measurements, or repeating the measurement. The answer is D, making unobtrusive measurements. Making unobtrusive measurements should enhance the accuracy of the measurement by limiting the possibility of the Hawthorne effect. That is, the possibility that a study subject may change behavior based on their awareness of being studied. Blinding is another method to enhance accuracy. The other answers are techniques that enhance both precision and accuracy. The next set of questions is on sample size determination. A study wishes to determine if a new drug with less adverse effects than albuterol has the same efficacy as albuterol. What type of hypothesis should be used to determine sample size? Superiority hypothesis, null hypothesis, non-inferiority hypothesis, equivalence hypothesis, or alternative hypothesis. The answer is D, equivalence hypothesis. In this example, the new drug has the benefit of a better safety profile than albuterol. The authors only need to determine if the efficacy is the same. The efficacy does not need to be better than albuterol because it has safety benefits. The three hypothesis types are superiority, equivalence, and non-inferiority. Each of these has its own null and alternative hypothesis. The name of the type of hypothesis is based on the alternative hypothesis. The alternative hypothesis for a superiority study is that one group is better and one group is worse. The alternative hypothesis for an equivalent study is that the groups are the same. The alternative hypothesis for a non-inferiority study is that one group is the same or better than the other group. A study wishes to determine the effect of a presenting complaint on the rate of psychiatric admission. A pilot study revealed a 40% admission rate for suicidal ideation. The admission rate for conduct disorder would be considered significantly higher if it is greater than 60%. What is the effect size to be used in the sample size determination? 20%, 60%, 40%, 10%, or 30%? The answer is A, 20%. The effect size is the minimal difference that would be considered clinically significant. The admission rate in the suicidal ideation group is 40%. The author would consider an admission rate of 60% for the conduct disorder group to be clinically significant. In a study of two proportions, the effect size is the difference between the two proportions, 60% minus 40%, or 20%. A study is comparing the efficacy of acetaminophen to ibuprofen in reducing fever. Historically, acetaminophen reduces fever by 2 degrees centigrade with a standard deviation of 0.5 degrees. Note that this data is made up for this question. The investigators would conclude that ibuprofen was clinically superior if it decreases temperature by 0.5 degrees more than acetaminophen. What is the effect size to be used to determine the required sample size? 2, 1.5, 0.5, 0.25, or 1.0? The answer is E, 1.0. The effect size is the minimal difference that would be considered clinically significant. The decrease in fever in the acetaminophen group is 2 degrees. The authors would consider a decrease in fever of 0.5 degrees or more than the acetaminophen group to be clinically significant in the ibuprofen group. This would mean a decrease in temperature of 2.5 degrees in the ibuprofen group. The mean difference is 2 degrees minus 2.5 degrees, or 0.5 degrees. In a study of two means, the effect size is the mean difference divided by the standard deviation. In this example, the standard deviation around the decrease in temperature with ibuprofen is unknown. We will substitute the standard deviation in the acetaminophen group as a best guess. In this case, the effect size is the 0.5 degree difference, that is 2.5 degrees minus 2.0 degrees, divided by a standard deviation of 0.5. The effect size, 0.5, divided by 0.5, is 1.0. An investigator is determining the sample size required for a study comparing the mean decrease in temperature with two different antipyretics. Which of the following would increase the power to find a difference? A decrease in alpha error from 5% to 1%, change from a superiority to an equivalence hypothesis, a decrease in the effect size, using a paired statistical test, or decrease in the beta error from 20% to 10%. The answer is D, using a paired statistical test. This is the only option that would increase the power to find a difference. In this case, the paired t-test would be selected. Paired tests compare the individual patient to themselves rather than to the group. This decreases the variability in the numerator and results in a decrease in sample size required and an increased power to find a difference. This is the formula for sample size determination when comparing two means with the independent sample t-test. From the formula, anything that increases the numerator would increase the sample size, and anything that decreases the denominator would increase the sample size. In other words, any factor in the numerator is directly proportional to the sample size, and any factor in the denominator is indirectly proportional to the sample size. All of the responses, other than using a paired statistical test, would increase the sample size. A decrease in alpha error and beta error, as well as an increase in variability, would increase the sample size. Of note, a decrease in alpha and beta error increases the z-scores for alpha error and beta error in the numerator. A decrease in effect size would result in the need for a larger sample size, and use of an equivalence hypothesis would increase the sample size. The next set of questions is on writing a research protocol for IRB submission. Which of the following is not a criteria for waiver of documentation of informed consent? The consent is the only record linking the subject. The study entails no more than minimal risk. The principal risk would be potential harm resulting from a breaching confidentiality. The study subject does not speak or read English, or subjects will be provided with a written statement regarding the research. The answer is D. The study subjects do not speak or read English. Patients should not be excluded from participation solely based on the inability to speak English. Study materials, including consent, should be available in the language of the subject. A waiver of documentation of informed consent is called a verbal consent. Any waiver of full informed consent requires that the study entails no more than minimal risk. The other three responses are criteria for waiver of documentation of consent. A 9-year-old girl with a brain tumor and her parents are approached to participate in a trial of a new experimental device to reduce blood flow to her tumor. In addition to authorization to collect protected health information, what elements of the informed consent process are required? Consent of the parents only, assent of the child only, consent of the parent and assent of the child, or neither consent nor assent are required. The answer is C, consent of the parent and assent of the child. In general, assent should be obtained in those over 7 years of age, though at younger ages this should be evaluated on a case-by-case basis. Assent of the child should be obtained in a language appropriate to their level of understanding. Parents must attest to the assent of the child and consent to their participation. Authorization for the collection of a protected health information should also be obtained. Which of the following is not considered to be a vulnerable research population? Pregnant women, children, those with diminished capacity, residents or house staff, or all are considered vulnerable populations? The answer is E, all are considered vulnerable populations. In general, vulnerable populations are those at increased risk from participating, those unable to fully comprehend the nature of participation, and those who are at risk of coercion to participate. Pregnant women, children, those with diminished capacity, and prisoners are considered vulnerable populations. Medical students, residents, fellows, and faculty are also considered vulnerable populations as they may feel coerced to participate. The next set of questions is on writing a research proposal for grant funding. Of the NIH institutes, one is dedicated specifically to emergency medicine research. True or false? The answer is false. There is no institute dedicated to emergency medicine research. The Office of Emergency Care Research, the OECR, is part of the National Institute of Neurologic Disorders and Stroke. The OECR does not directly fund research, but works across other institutes and centers to fund emergency medicine research. Which of the following is not an NIH criteria that is used to score research proposals? Importance, such as significance and innovation, rigor and feasibility, such as approach and timeline, expertise and resources, such as the investigator and the institution, and recommendations, such as those from the chairman and the research mentor. The answer is recommendations. Recommendations are not part of the review criteria. Responses A, B, and C correspond to the 3 factors that the NIH uses to review proposals. These new criteria were initiated in 2025. Match the research topic area to the non-NIH federal agency that would be the most likely to fund it. Traffic safety to 4, the Department of Transportation. Adolescent violence to 3, the Department of Justice. Disaster preparedness to 1, the Department of Defense. Toxicology to 2, the Environmental Protection Agency. And injury prevention to 5, the Consumer Product Safety Commission. What is the most important factor to have for a new investigator applying for a federal grant? Prior research in the same area, advanced research training, prior grant funding, an experienced mentor with prior grant funding, or a great idea fulfilling the finer criteria. The answer is D, an experienced mentor with prior grant funding. All of the factors are important, and the more that you have, the better your chances. The NIH is looking for a great idea and evidence that you can complete the project as proposed. Finding a grant-experienced mentor from the beginning is likely the most important step. They can guide you through the process and provide the experience that the NIH is looking for. The next set of questions is on data collection. Which question would be better to include in the survey you are designing to assess the association between level of activity and asthma severity? How much exercise do you usually get? Or, during a typical week, how many hours do you spend exercising? The answer is B. During a typical week, how many hours do you spend exercising? Question A is unclear. It is unclear how to respond to the phrase, how much exercise? Which question would be better to include in a survey of parents to determine their knowledge of a medication's availability without a prescription? What medication can you get without a doctor's prescription? Or, what medication can you get over the counter? The answer is A. What medications can you get without a doctor's prescription? Question B includes the phrase over the counter, which is medical jargon. Avoid the use of medical jargon, acronyms, and abbreviations that may confuse the respondent. Which question would you ask to determine the average number of beers consumed in a week by adolescents presenting to the ED with alcohol intoxication? How many beers do you drink in a week? How many beers do you drink in a typical week? How many beers do you drink in a week when you have more than most weeks? The answer is B. How many beers do you drink in a typical week? Question A could be used to assess the number of beers if drinking is consistent from week to week. Question B and C could be asked to assess drinking that is variable from week to week. In question B, the phrase in a typical week could be used to determine an average. In question C, the phrase in a week when you have more than most weeks would provide an assessment of the extremes. Which questions would you include to assess the pediatric resident's viewpoint on the value of the simulation curriculum? How satisfied are you with the simulation curriculum? How satisfied are you with the frequency of the sessions? And how satisfied are you with the cases used? And how satisfied are you with the debriefings? The answer is B. The simulation curriculum is a complex construct. There are many areas of the curriculum that can be assessed. This requires more items to assess. Using the 3 questions in answer B would allow you to assess 3 different aspects of the simulation curriculum: frequency, cases used, and debriefings. This would provide more insight into what is going well and what requires improvement. The next set of questions is on data management. Which of the following software programs allows data entry to be formatted to look like your data collection sheets to reduce transcription errors? Database, for example, REDCap. Word processing, for example, Microsoft Word. Spreadsheet, for example, Microsoft Excel. Or statistical programs, for example, SPSS. The answer is database programs. There are benefits and disadvantages to the major types of software used to create a data set. Database programs can be formatted to appear like your data collection form. This can reduce transcription errors. REDCap is a database program that allows for electronic data capture. Which of the following variables could be included in a de-identified data set? Subject's name, laboratory results, medical record number, health insurance account number, or address? The answer is B, laboratory results. Any information about a patient's medical care that can reasonably be thought to identify the subject is considered protected health information. The only response that is not considered protective health information is laboratory values, and this is true only if they are not linked to any other type of protected health information. You are an assistant professor at a renowned university. You conduct a randomized clinical trial on a new anti-epileptic for status epilepticus. Who primarily owns the data? You, the principal investigator, the public not-for-profit funding source, the sponsoring institution, a private for-profit funding source, or the research subjects? The answer is C, the sponsoring institution. The others have the right to access the data to some extent. Care should be taken in context with private for-profit funding sources to ensure the right to publish the data. The next set of questions is on presenting your results as a poster or platform presentation. Which is not a typical component of a platform presentation? Introduction, background, hypothesis, methods, results, conclusions, limitations, implications, or references? The answer is E, references. References are not typically included in a poster or platform presentation. Prior studies may be referred to in the study introduction and conclusions. The other responses contain the essential components of a poster or platform presentation. Your study found that 90% of seizures stopped within 5 minutes after treatment with anti-epileptic drug A and 80% with anti-epileptic drug B. How should the results be presented in your poster? Seizure cessation, AED-A 90%, AED-B 80%, risk difference of 10% with a 95% confidence interval of 7 to 12%, or seizure cessation, AED-A 90%, AED-B 80%, p-value equals 0.04. The answer is A, mean difference with a 95% confidence interval. When possible, results should be presented as an effect size with a 95% confidence interval. This may be an absolute risk difference when the outcome variable is categorical, such as seizure cessation, yes or no, as seen in this question, or as a mean difference if a continuous outcome measure is used. The effect size may also be expressed as a relative measure, such as the relative risk or odds ratio. The effect size and confidence interval provide both a quantitative and qualitative measure of statistical significance. The effect size can also assist in determining what is considered a clinically significant difference. P-values only provide a qualitative measure of statistical significance, that is, statistical significant, yes or no. The next set of questions is on manuscript submission. Which of the following is not a goal of the peer review process? Determining the validity of your study design, assessing appropriateness to the journal's target audience, improving the quality of the manuscript prior to publication, assessing for possible fraud, or reviewing potential conflict of interest concerns. The answer is D, assess for possible fraud. One of the weaknesses of the peer review process is that it is not intended to identify fraud. Other weaknesses of the peer review process are that there is no evidence that it improves the quality of published manuscripts, reviewers have poor to no training, and inter-rater reliability among reviewers is poor, there is potential for bias, and it favors positive results. The other four responses or goals of the peer review process. Which of the following is not one of the characteristics of scientific writing? Clarity and precision, use of an active voice, speculation on potential conclusions, avoiding jargon, and avoiding excess abbreviations. The answer is C, speculation on potential conclusions. While the potential implication of the study results can be stated, it is important to limit the conclusions to those that are justified by the data. The other responses are characteristic of scientific writing. A faculty member has discussed your research project with you on multiple occasions and reviewed your manuscript prior to submission. What should her role be in the publication? Permission, authorship, copyright, acknowledgement, or none of the above? The answer is D, acknowledgement. The faculty member can be acknowledged for her contributions as a mentor with her written permission. She does not meet the criteria for authorship. The International Committee of Medical Journal Editors recommend that all four of the following criteria for authorship should be met. Contributions to the conception, or to the design, or the acquisition, or the analysis, or the interpretation of data, and drafting or revising the manuscript, and final approval of the version to be published, and agreement to be accountable for all aspects of the manuscript. Copyright is held by the publisher. The last set of questions is on research ethics. An investigator does not adequately disclose the potential harm of taking a research medication to the study subjects during the informed consent process. Which ethical principle does this violate? Beneficence, non-malfeasance, respect for persons, justice, or liberty? The answer is C, respect for persons. In this situation, the investigator does not provide the subject with all the information required to decide whether to participate or not. This limits patient autonomy and violates the principle of respect for persons. Partial credit could be given for B, non-malfeasance, or do not harm. Which of the following is not an important ethical consideration when defining a research question? Review all pertinent citations to modify the hypothesis and limit duplication of effort. The research hypothesis asks a relevant and answerable question. Utilize clearly defined, clearly relevant outcome measures. Outcomes must be measured with a validated instrument, or results will be generalizable and practical to implement. The answer is D, outcomes must be measured with a validated instrument. Validated assessment instruments should be used to ensure validity, but are not available for all study outcomes and are not required. The remaining responses are important ethical considerations when defining a research question. You are submitting a manuscript and are asked to disclose any potential conflicts of interest. Which of the following would not need to be disclosed? Institutional or departmental funding, stock owned in the company producing the study intervention, paid participation in the company's speakers bureau, your spouse is an employee of the company, or you provide expert witness services for the company. The answer is A, institutional or departmental funding. You do not need to disclose institutional or departmental or public funding sources for a project. Generally, you would disclose anything that a reader would consider as potentially influencing the submitted work. The other four choices represent potential conflicts of interest. We have come to the end of the PEM Fellows Research Design course.